Now, these extremely high numbers of new cases are putting a strain on hospitals across the state, but especially the ones out in rural areas where there aren't as many healthcare professionals. Many of those hospitals are also serving patients from multiple counties. And tonight, our investigative reporter Ben Hall gets an inside look at the impact in Cumberland County.
Cumberland Medical Center in Crossville is about 2 hours outside of Nashville. We saw what's happening there through the eyes of a woman who got COVID and feels thankful to be alive.
It brings back a lot of stuff, you know.
This wasn't easy for Rhonda Wyatt.
I didn't think I was going to come home. I really didn't.
She stood outside the hospital where she almost died to thank someone who cared for her.
He was my nurse.
J.J. Johnson works overnights in the hospital's COVID unit.
I'm very grateful because a lot of people don't want to work that way.
Every time he went in a room, he put on layers of protective gear. He brought medicine, but mostly he encouraged her for the 12 excruciating nights she was there.
You're laying there and you think you're going to die any minute. It's very scary.
How you doing?
I'm better. I'm not 100%, but I'm better.
This is the first time they've talked since she left.
You were just so kind to me, and anything I needed, and you'd always come and check on me through the night, and I appreciate it so much.
Both wearing masks, she could finally thank him for being there.
It means a lot when you're laying up there by yourself and can't have no family, and think you're not going to be here the next day.
Their meeting comes as Cumberland County is seeing a sharp spike in cases. This week, the White House task force moved the county into the red zone because of increasing cases. According to the State Department of Health, more than 50 people tested positive on a single day last week, and deaths are increasing.
People's not being careful, and I think the rise was because of Halloween.
It's surprising that it's still going up. You're hoping to see a downward trend.
The Department of Health reported more than 80 people hospitalized in Cumberland County. But that's not the number inside the Cumberland Medical Center. It also receives patients from nearby Bledsoe County and from Fentress County, which had its hospital close.
It's very serious.
Laura Key is the nurse manager, responsible for staffing the COVID unit. 20 nurses routinely work there.
Sometimes our concerns are space, sometimes our concerns are staffing, and I'm speaking on behalf of every hospital in America right now.
Every nurse, including Johnson, volunteered to work inside the unit. At age 23, he's most concerned about exposing his parents to the virus.
I've seen 30, 40-year-olds, at their sickest that they've ever been, sicker than you can imagine.
Rhonda Wyatt feels lucky. She and her husband are now back at work painting houses. But doctors worry she may have suffered a mini-stroke, one of the lasting effects of COVID.
I'll admit, I'm scared to death still of getting it again.
After all she's been through, she just wanted to thank a familiar and comforting face.
People need to appreciate them very much because it's very dangerous.
It's also really rewarding, though, seeing the other end of it, seeing people that, like Rhonda, see people that are doing better, getting out of here.
But for nurses like Johnson, the battle is far from over. The rising cases point to a scary winter.
Oh, I'm very grateful.
A few moments of thanks help keep them going.
It lifts our spirits. It's a shot in the arm for nurses. That's our medicine. That's what we need.
There is no mask mandate in Cumberland County, but the county mayor is urging people to social distance and wear a mask when necessary. Rhonda Wyatt emphasizes people need to take this very seriously. Ben Hall, News Channel 5 investigates.